let's talk nutrition. This is your high-yield explainer designed to help you absolutely crush this section on your board exams. We're going to cut right through all the fluff and focus only on what gets you points.
So here's the game plan. We're going to start with the basics, build up to the nitty-gritty biochemistry, and then see how it all plays out in those classic clinical vignettes you're guaranteed to see.
Okay, first things first. We have to start with the absolute bedrock of vitamin biochemistry. Seriously, if you get this one concept down, it explains almost everything else, from who gets toxic to who gets deficient. Now you might be thinking, fat versus water soluble, okay, I get it. But no, this isn't just some random factoid. This one difference is the key that unlocks, I don't know, a dozen different question stems. It tells you everything about absorption, storage, and clinical risk, which, is exactly what the exam writers love to ask about. So here's the bottom line. For your fat-soluble vitamins, that's A, D, E, and K, you need bile to absorb them. So what does that mean clinically? Well, any patient who can't absorb fat properly, think about your patients with cystic fibrosis, celiac disease, Crohn's, they are going to be deficient in A, D, E, and K. It's a direct link. On the flip side, the water-soluble vitamins, they pretty much wash right out of your system, which means you've got to get them in your diet, day in and day out.
Okay, now that we have that foundation, let's talk about the B-complex vitamins. I want you to think of these as the spark plugs for your body's metabolic engine. They are absolutely essential. Without them, the whole system just grinds to a complete stop.
All right, let's zoom in on thiamine, vitamin B1. The most high-yield thing to know is that it's a cofactor for count them, 4 key dehydrogenase enzymes. If you need a mnemonic, think BAPT. When you're deficient in B1, you're essentially shutting down the entire TCA cycle, and that's huge, no energy production. And that explains why you see such devastating neurologic and cardiac symptoms. Okay, listen up, because this is a never-ever clinical rule. It is a massive exam trap. You have a patient, likely with a history of alcohol use, and they come in confused, they can't walk straight, and you give them IV glucose, you could literally kill them. Giving that glucose first chews up the last tiny bit of thiamine they have and pushes them into a full-blown Wernicke encephalopathy. Remember this forever. It's always thiamine first, then glucose. Banana bag before sugar water, no exceptions. And here's a classic picture you've got to recognize. This is pellagra, which is niacin or B3 deficiency. You see this dark, kind of scaly rash in a perfect necklace pattern? Your brain needs to immediately jump to niacin deficiency. Just lock in the 3 Ds: diarrhea, dementia, and dermatitis. All right, moving on to another USMLE favorite, pitting B9 against B12. They love this differential because on the surface, these deficiencies can look almost identical. But there are key differences, and we're going to break down exactly how you tell them apart every single time with no mistakes. So let's look at the why. Why do they both cause the same type of anemia? It comes down to this pathway right here. You need both folate, B9, and cobalamin, B12, to make DNA. So if you're missing either one, your cells, especially your rapidly dividing red blood cell precursors, can't make DNA properly. They get big and bloated instead of dividing, and boom, you've got megaloblastic anemia. Okay, this table right here, this is your money slide. This is how you nail the question. Look, they both give you megaloblastic anemia. They both give you high homocysteine. Forget that. The two things that let you tell them apart, the two things that are unique to B12 deficiency, are a high methylmalonic acid, or MMA, and those awful neurologic symptoms. If you see neurosymptoms or high MMA, the answer is B12, period. So let's switch gears to a couple of other fat-soluble vitamins, D and K. Now these guys are more than just simple cofactors. They're like master regulators, controlling huge critical systems in the body, namely your calcium levels and your entire ability to stop bleeding. So vitamin D's whole job is to crank up your body's calcium levels. It helps you absorb it from your gut and hold onto it in your kidneys. So if you're deficient, your bones get soft and weak. In kids, we call this rickets, and that image of the bow legs, that's a classic visual diagnosis you just have to know for the boards. And then there's vitamin K. Just remember K for coagulation. Here's the deal. Without vitamin K, your liver makes the clotting factor proteins, but they're useless. They don't work. Vitamin K is what activates them. And this is exactly why we give a shot of vitamin K to every single newborn. Their little guts are sterile, they can't make any on their own, and this one shot prevents them from having a catastrophic bleed. Okay, so we've covered a lot of the basic science, but you know the USMLE isn't just about facts, it's about applying them. So let's run through some classic clinical vignettes, the kind of stuff you are almost guaranteed to see on test day. So you get a question stem about a malnourished child. Your first thought has to be, is this kwashiorkor or marasmus? And there's one key differentiator: edema, swelling. Kwashiorkor is all about protein deficiency. No protein means no albumin, and no albumin means fluid leaks out into the tissues. That's where you get the swollen belly and puffy legs. Marasmus, on the other hand, is just straight-up starvation, a total calorie deficit. That's the skin and bones look from severe muscle wasting. Now this is an incredibly high-yield concept. Chronic alcoholism creates total biochemical chaos, and it all comes down to one thing: a crazy high NADH to NAD plus ratio. And that one change derails everything. It shunts pyruvate to lactate. Boom, lactic acidosis. It blocks gluconeogenesis. Boom, fasting hypoglycemia. And it shoves everything towards making ketones and fat. Boom, ketoacidosis and a fatty liver. You have to understand this pathway.
Okay, you ready? Let's check what you've learned. We're going to do a few quick USMLE-style questions to make sure these concepts are locked in.
Okay, let's dissect this one. Pay attention to the clues. You have a vegan diet. You have megaloblastic anemia. But the real kickers? Pins and needles. That's neurologic symptoms. And elevated methylmalonic acid. What's the only deficiency that fits all of that?
Yep, it has to be vitamin B12, or cobalamin. Why? First, vegans are a classic risk group because B12 is only in animal products. But more importantly, that combination of megaloblastic anemia, neurologic symptoms, and the high MMA is completely pathognomonic. It can't be anything else.
All right, next question. A chronic alcoholic with confusion, ataxia, nystagmus. A classic triad. The resident orders a dextrose IV. What happens next? Think back to that big red flag we talked about.
You got it. You're going to precipitate or at least worsen a Wernicke encephalopathy. By giving glucose, you're forcing glycolysis to run, which uses up the very last bit of thiamine that poor patient has. You're pushing them right over the clinical cliff. The rule, one more time, is always thiamine first, then you can give glucose.
Okay, last one. This is more of a public health and physiology question. Why does pretty much every newborn in the US get a shot of vitamin K right after they're born? What are we trying to prevent?
And the answer is to prevent hemorrhagic disease of the newborn. Think about it. They're born with sterile intestines, so they have no gut bacteria to make vitamin K. And breast milk is actually a pretty poor source, so they're at a huge risk for a major life-threatening bleed. That one injection completely solves the problem. And that's a wrap on our high-yield nutrition review. You see, the real key here isn't just cramming facts. It's about seeing the connections, how a missing enzyme leads to a specific symptom, how a pathway gets derailed and causes a disease. That's how you crush these questions. So what connection are you going to master next?